This retrospective cohort study was designed to explore the risk of neurodegenerative disease among male former international rugby union players. Autopsy studies of former contact sport athletes, including soccer and rugby players, frequently report chronic traumatic encephalopathy, or CTE, which is a neurodegenerative pathology associated with exposure to traumatic brain injury. Nevertheless, little is known about risk of neurodegenerative disease in these populations. Our previous findings from the study Football's Influence on Lifelong Health and Dementia Risk, also known as the FIELD study, reported first data on dementia risk among former professional soccer players. Risk of the disease in former rugby players, however, thus far remained unknown. The final cohort for analysis comprised 412 former international rugby players and a comparison group of 1,236 matched controls. Rugby players were matched with general population controls on sex, all were male, year of birth, and socio-economic status, which was based on last known postcode. We were then able to link these individuals to their health record data, including hospital admission, prescription information, and death certification data, in order to explore their lifelong health outcomes. Overall, there was no difference in all-cause mortality between former rugby players and their matched controls. However, the proportional hazards assumption was not met. Reflecting this, all-cause mortality among former rugby players was lower up until the age of 70 years, as highlighted in blue. Thereafter, it was no different from that of matched population controls, as highlighted in pink. Overall, risk of neurodegenerative disease was over 2.5 times higher in former rugby players than expected, with rugby players having higher risk of mortality, hospitalisation, and prescriptions relating to neurodegenerative diseases. Risk varied by disease subtype, a finding which is similar to observations reported in American football and soccer. Perhaps most notable is the risk of motor neuron disease. While the absolute number of former rugby players with motor neuron disease was low in the present study, the high risk of motor neuron disease observed relative to the comparison group is at least consistent with, if not higher than, that observed in previous athlete studies. We report no difference in risk between player positions when subgrouped as either forwards or backs. This study adds to the understanding of the association between contact sport participation and risk of neurodegenerative disease, with our data demonstrating higher risk among male former international rugby union players than among general population controls, matched by age, sex, and area socioeconomic status. Of particular concern are the data on motor neuron disease risk among players, which requires immediate research attention to further explore the specific association. Whilst further research is required, in the meantime, precautionary strategies to reduce unnecessary exposure to head impacts and injuries across all contact sport should be promoted.